How does ER/PR status affect invasive ductal carcinoma? Imagine a puzzle where each piece helps doctors understand how a cancer might behave and how best to treat it. One of those crucial pieces is the estrogen receptor and progesterone receptor status. These are proteins found on breast cancer cells that respond to hormones like estrogen and progesterone. Knowing whether these receptors are present or absent helps shape the entire approach to managing invasive ductal carcinoma, the most common type of breast cancer. If the tumor tests positive for estrogen and progesterone receptors, meaning it is ER-positive and PR-positive, it usually looks more like normal cells under the microscope. These tumors tend to grow more slowly and are often less aggressive. This better behavior translates into a more favorable outlook for the patient. Studies show that patients with hormone receptor-positive tumors tend to have higher survival rates, especially when the cancer is caught early. The presence of these receptors also opens up specific treatment options. Hormone therapies like tamoxifen or aromatase inhibitors can block the hormones that fuel these tumors. This targeted approach can significantly reduce the risk of the cancer coming back and improve overall survival. Because these tumors relying on hormones, blocking their access to estrogen or progesterone can be very effective. On the other hand, if the tumor tests negative for both estrogen and progesterone receptors, it is called ER-negative and PR-negative. These cancers are generally more aggressive, tend to grow faster, and are associated with a poorer prognosis. They do not respond to hormone therapies, so treatment usually involves chemotherapy or other targeted treatments. This makes managing ER-negative tumors more challenging, but advances in targeted therapies are continually improving outcomes. It's also important to understand that some tumors may be positive for only one receptor. For example, a tumor might be ER-positive but PR-negative. These cases can have different behaviors depending on additional factors like HER2 status. For instance, if the tumor is HER2-negative, single hormone receptor positivity might suggest a slightly worse prognosis, leading doctors to consider more aggressive treatment. Conversely, if the tumor is HER2-positive, the prognosis and treatment strategies may differ again. Statistics show that patients with ER-positive tumors generally have about a 10% better chance of survival over 5 years compared to those with ER-negative tumors. This difference highlights how understanding receptor status helps doctors personalize treatment plans. When breast cancer is detected early and is localized, the 5-year survival rate can be as high as 99%, partly thanks to targeted therapies that work best in hormone receptor-positive cases. In summary, estrogen and progesterone receptor status are key factors in understanding invasive ductal carcinoma. They influence how aggressive the cancer might be, what treatments are most effective, and what the outlook for the patient might look like. Positive hormone receptor status usually means a less aggressive tumor and more treatment options that can improve survival. Conversely, hormone receptor-negative tumors tend to be more aggressive and requiring different, often more intensive, treatment approaches. Always remember, each case is unique, and discussing your specific situation with a healthcare professional is essential for the best care.